and you can see that pattern repeated. You can click each on any of these boxes and see which state is there. You can go ahead to the next slide. You can, this is just a subset of some of the metrics, but you can click on the metrics like self-reported health or infant mortality and see the pattern is still there. You can click on the state to pull down and see more about the details of the particular state. And here's an example from what you'll see from Texas. And there's also a section where it looks at the various parts of the policies, that are sort of clumped. And let me just say a little bit about policies. So when we say policies that make it easier or harder, policies that expand voter access include things like no excuse mail-in early voting, inclusive voter registration programs and automatic voter registration, online and same-day voter registration, enabling voter registration in education and service settings, non-strict voter ID, and reinstatement of voting rights for people who are returning or have been incarcerated. So those are what we mean by inclusive voting policies. And if you go to the site, you can go to the end, and if you're a person who really likes to look at the data, you can find a chart where every single state is there and every single metric, and you can search by this way or that way to dig in deeper. And we designed this tool, and I remember I said at the beginning, some of this sounds really familiar and then some of it isn't as familiar to you, but we designed this tool to give you the tool to be able to tell the story so that you can feel confident that being a champion for these inclusive policies is actually aligned with your work as health and public health professionals. This came out in 2021. Next slide. Additional research has come out since then that has reinforced these findings. We've discovered went back from 96 to 2020 to look at the relationship between the ease or difficulty of voting and health, self-reported health, and saw that that pattern was still there. We also saw that states that had better voting access had lower uninsured rates. Counties in the states where it's easier to vote had lower pre-vaccine COVID case and mortality rates. Southern counties that had the Voting Rights Act protection had significant reductions in Black infant deaths following the Voting Rights Act. So they were looking at the specifics around health disparities in intentionally looking at that. And civic engagement, and this is really an important thing to know, being involved as a young person matters. Civic engagement that was including voting, volunteering, and activism among adolescents and young adults is positively associated with better future income, education levels, and mental health. And I know mental health of our young people is on a lot of people's mind, and we've been talking and thinking about how to invest in improvements in mental health. Getting young people actively involved in voting and civic participation early in life matters. Next slide. We also know that when there is voter suppression or we've made it difficult for people to vote, it disproportionately impacts the very same communities that are experiencing the greatest health disparities: Black, Latino, American Indian, young, people with disabilities, and low-income voters. And the data is there to show that people in these populations end up with longer polling lines, fewer polling places, are often disproportionately burdened by stringent voter ID laws, and Black voters are more likely to be flagged for removal from voter rolls, and 1 in 5 voters with disabilities need assistance or had difficulty voting in 2022. If those voters had voted at the same rate as people without disabilities, there would be 2 million more votes cast. So these policies make a difference. Next slide. It's been contentious. The struggle for representation has been contentious, and I guess we shouldn't be wondering what we, why. Did you quit sharing, or did I just, are you still sharing? So they've been contentious, and what you can see, I'm sorry, Nora, I lost the screen, the sharing thing.
Have other people lost the screen? Because it's still sharing on my end.
Yeah, I can still see it.
Okay. Interesting.
Let's see a thumbs up.
So I am, so what we see here on this electoral system landscape is basically that this is just a very brief, most recent time, but in 2010, we had Citizen United, and that allowed that we lost that Citizen United. I would say lost, because Citizen United was overturned. And that meant that now we have so much more money in elections that are not accountable, that we don't know where it's coming from. And then in 2012, we had Shelby Holder, and that struck back some of that pre-clearance the pre-clearance requirements that we just mentioned had benefited and decreased infant mortality differences. And then in 2020, we had an increase in voter participation, and people came out, and people learned of the different ways that they could make a safe voting plan. And a lot of people had always, just only knew one way to vote. And suddenly they knew that they could potentially do a mail vote, or they could have a drop box, or they could do some other things. So that, and there was just a lot of engagement, but immediately there was pushback on that. And just since then, we have had, states have enacted, I think it's like 22 or 26 states have enacted policies that make it harder to vote. Some states have enacted policies to make it easier to vote and protect the vote. So it's going both ways, but there's definitely been a lot of pushback. And that's part of why we're talking to you today, is because however you voted in 2022, or it might have changed. So we want we want to be sure we're looking at that. Next slide. We actually can't sit out and achieve our aims for inclusive civic participation without participating. I mentioned the unprecedented turnout in 2020, but still over a third of the people didn't vote. And then in 2022, only 46% of the population voted. And in Texas, it is more difficult to vote than it was 4 years ago. And then, because we're in public health and we're in the healthcare sector, I just want to point out this one point, and Nora's going to talk more about this. But healthcare workers themselves, including licensed healthcare workers like physicians, nurses, physician assistants, and dentists, are 12 to 23% less likely to vote than the general population. Less likely to vote than that 46% number that was in 2022. 12 to 23% less. So as health professionals, knowing these connections, we just would ask, what can public health do? And at this point, I'm going to ask Nora to talk about what public health can do. Thank you.
Yeah, thanks, Jean, for laying that important context. So let's talk about what can we do with the information that we have, knowing that health and democracy are interconnected. Well, we at Healthy Democracy, Healthy People believe in engaging in systems change at every level. And so we see that from the organizational level, state and local level, and national level. We have to be engaging in this work. So to share a few kind of examples of each of these levels, at the organizational level, and I want to take a moment to pause and appreciate the Society for Public Health Education, because they were one of the first health organizations nationally to pass a policy statement recognizing the relationship between voter registration, participation, and health. And so we can encourage our professional organizations to adopt these policy statements. We can advance organizational internal policies that promote civic and voter participation for our employees and members, like offering time off to vote, integrating voter registration into our onboarding, HR processes, and we can encourage our members, coworkers, and colleagues to vote. At the state and local level, this is the picture that I'm showing on this slide is actually an example of one of our Minnesota SOPI members, who was the chair of the advocacy committee, testifying, providing this evidence on the relationship between voting and health in support of an expansive policy that aimed to increase in civic and voter participation and achieve a multiracial democracy in Minnesota. And so we at the state and local levels can build collective power and join coalition efforts to promote opportunities for civic health and voter participation. And we can also work with our state and local health departments and health systems to incorporate civic and voter participation measures into our health improvement plans and strategies. And then at the national level, we can advocate for policies that strengthen federal election standards. We can promote opportunities for voter registration in federal health programs like in healthcare.gov and in our Medicaid programs. And we can encourage Healthy People 2030 to provide resources and technical assistance to promote civic and voter participation in health settings. And this is really critical because this last point is really critical because in 2023, Healthy People named improving voter participation as a core objective of the 2030 framework. And so it's really important that we encourage Healthy People 2030 to provide resources so that we can make that objective actionable and improve nonpartisan voter participation across all of our communities. And so just to highlight that, right, we have increasing the proportion of voting age citizens who vote as a core objective in Healthy People 2030. Currently, the voter participation rate objective is marked as getting worse. And so we all have a responsibility to take action and promote nonpartisan participation to move this, status from getting worse to hopefully improving over the next election. And I wanted to take a moment to remind each and every one of you, you might be thinking about, I don't think I can move my organization, or I'm not ready to engage in state and local advocacy work, but health is always on the ballot. And so you as an individual can do a lot to promote civic and voter participation and advance health. You can make a voting plan for every election. Today is National Voter Registration Day. And the voter registration deadline, we'll get to it in a second, but it's October 7th. And so I really encourage you to take that first step in making your voting plan by making sure you know if your voter registration is up to date. You can invite your colleagues, friends, and family to join you in making a voting plan, and you can promote opportunities for nonpartisan civic and voter participation in your workplace and with your colleagues. And also invite them to learn more. And I want to share a really timely call to action for everyone to join in on an effort led by Healthy Democracy, Healthy People, Civic Health Alliance, and Vote ER, aimed at promoting that nonpartisan civic and voter participation across the health sector, which is Thrive Through Civic Health, We Will Vote. So you may be asking yourself, why are we trying to organize the health sector to participate this year? Well, nationally, we are the largest workforce and account for at least 22 million workers nationwide, which is about 14% of the workers in the United States. And that only counts our licensed health professionals. So us in public health, even some of us maybe practicing in social work, aren't necessarily reflected in that 22 million workers. In Texas, The healthcare workforce accounts for 1.5 million workers. And in Houston alone, it's one of the largest growing workforces in the city, which represents about 10% of the state's overall workforce. In 2020, a third of US eligible voters nationwide did not cast a ballot. And more than a half of eligible voters across the country did not vote in 2022. And just to highlight the Texas data again, in 2020, 52% of eligible voters in Texas cast a ballot. And in 2022, only 37% of eligible voters in Texas voted. And so it's really clear that we have an opportunity to organize and promote nonpartisan participation across the state, across the health sector, and across the United States. And again, as a reminder, healthcare workers, including physicians, nurses, physician assistants, and dentists, are 12 to 23% less likely to vote than the general population. So the Thrive Through Civic Health We Will Vote initiative starts with an invitation to health organizations to offer an organizational commitment that says, as leading health organizations, we commit to strengthening our democracy by encouraging nonpartisan voter participation across our memberships, employees, and affiliates. And I'm really pleased to announce that we have over 70 partners ranging from health organizations at the national level to state and local affiliates, and even some family practices and preventive medicine associations, representing over 120,000 health professionals nationwide. And so if, an organization you're a part of joins this initiative, they won't be doing so alone. They will be joining a welcome community of health professionals and health organizations, recognizing that it's our job to promote nonpartisan civic and voter participation across our sector this year. And we also have an invitation to health professionals individually to join the initiative by pledging to vote. And the pledge to vote simply says that I understand the health of my community hinges on the health of our democracy, and that robust civic participation is required to advance health and racial equity. I understand that the first step starts with me. I join with my colleagues and institutions across the health sector, and I will vote in upcoming elections, encourage friends, families, and/or colleagues to vote in upcoming elections, work with my professional organizations and/or my workplace to promote the We Will Vote initiative, and support elections through volunteer roles in my local community. If you'd like to join the We Will Vote initiative by pledging to vote, you can actually scan the QR code on this slide, and I'll make sure that they get sent out afterwards as well, and pledge to vote before we end our call today. And as a reminder, again, health is always on the ballot. You may see health on the ballot when you're voting on specific referendum or local ballot initiatives, but health is also on the ballot when we elect any member of a governing body. So thinking about judges, sheriffs, school boards, our transportation boards, our state and local governments. They make decisions about public safety, violence prevention, healthcare access, pandemic response, public health authority, and all of the social determinants of health. So it's really important that we show up this year and in every election that we're eligible to vote. As a reminder, in Texas, here are some key election deadlines. So everybody all across the country, the election takes place on November 5th, 2024, which is a Tuesday. Your last day to register to vote in Texas is October 7th. So join us today as National Voter Registration Day in checking your registration and making sure it's up to date for your, if you recently moved or changed your name or have other potential changes impacting your registration. Your mail-in ballot application deadline is October 25th if you're eligible to vote by mail or absentee. October 21st is when early voting begins, and early voting ends on November 1st. So it's really important to keep those deadlines in mind. Again, polling locations close at 7 p.m. Central on November 5th. And you can be vote ready by scanning this QR code, which will actually take you to votetexas.gov to make sure you have a voting plan that includes your polling location, making sure you've checked your voter registration before the deadline, and have a plan to get your ballot in by 7 p.m. on November 5th. I'm gonna leave us here for questions and quickly put in the chat. I'm gonna stop sharing and put in the chat the last CE form that if you are participating for a social worker Texas CE, please fill out this feedback form to confirm that you completed the session today. And now I'll open it up for questions. And it looks like Irish has their hand up. I don't know if
Okay, sorry, I just unmuted her if she'd like to speak. And if anybody else has any questions, there's a Q&A that you can, where you can add your questions, or you can raise your hand and I will unmute you. I have a question though. I really enjoyed hearing all of that. Do you have any nonprofit organizations that you like to get involved with or other, nonpartisan ways to get involved to help people vote?
Well, we're one of those.
Okay.
But there are many groups in it depends on the state on who's working. I mean, you need to do some research, and Nora, I don't know the names of the specific sort of ad groups that are working to protect and defend democracy in Texas. I can name them off in some other states. Do you have examples of those in Texas?
Yeah, so I think we oftentimes share resources from the League of Women Voters, which has really great nonpartisan resources at the national level, at the state level, at the local level, that are nonpartisan and help folks understand both what they can expect to see on their ballot in terms of who's running and what what stances they've taken, and also helping folks navigate the key elections deadlines and resources you need in order to vote. So that's one community partner that we're really happy to be partnering with at the national and state level. And then we also partner a ton, like I said, in the We Will Vote initiative. We partner with Vote ER and Civic Health Alliance, which has really great nonpartisan resources, like their badges that you can scan to help make sure that folks in your community are vote ready ahead of the election.
I wanted to just piggyback, and while we were trying to hear from Irish, piggyback on one of the things that Nora said, and that is I would strongly encourage everyone on this call to double check their registration today by going to that link that we have a code for, and or just the Texas Secretary of State's office. And one of the reasons I'm saying that is a huge number of people, was it 500,000 or a million people, were removed from the voting polls in Texas in the last couple of years. And so you may think that I've gone to my place and I've done it before, but you can't be sure unless you double check. So I would encourage you to do that, and then to go and ask your friends and your neighbors and your other family members to do that as well this week, because you still have time to register before October 7th. And after October 7th, you can't register anymore. So this is a really critical moment for people in Texas to be sure that you can make a voting plan. You can think more about the candidates and all of those things between October 7th and the actual election, those last 2 weeks. But honestly, right now, to be sure that you can vote, is going to be most important, and that you're registered. And one of the things that we learn is that people, when you ask them why they didn't vote, they say, well, I wasn't registered. And that's their main reason why they didn't end up voting.
Yeah, I've volunteered before to help people with their their registration and ID questions at the poll, because those lines can be so long. And then some people just moved here from another state and didn't know they needed to be registered in advance. So there's definitely a lot of different ways to help. So yeah, I love the work that you guys are doing. What is the best way to get involved with you?
Well, you can
Yeah.
complete that individual form, and then we can start a conversation. So that form, and or you can bring your, we can talk about how to engage your organization. We are dedicated to building a coalition in Texas. We're focused on the Houston area right now. So if anybody is in Houston, we're looking at how to build a coalition of health professionals and health systems that are committed to being champions for health and democracy. And we get to figure it out together how we're going to go forward and do that. I do want to, I don't want to overstate this case, but Texas is the hardest state to vote in the country. And when you just said that when people just move here, they didn't know, other states, you can vote, that you can register that very day. So people wouldn't know that you have, like, it wouldn't just be common knowledge that you have these certain steps you have to take, and you have more strenuous IDs, identification information. And, so there's going to be some barriers, and we're very interested in finding out after the election and talking and engaging in people in Texas. What was your experience like? What worked and what didn't work? And how would we work together to make it more accessible for people?
Yeah, I think one thing I like to do is really be the a person that has a lot of information on, like, here's how to look up the polling sites to see which polling sites are fast, how they're moving, and knowing the hours and the dates, so that if anybody asks, like, hey, where do I go register? I know all the libraries around Austin are registering people. So I would definitely encourage everybody to just kind of become a source of knowledge locally. I'm curious, do you know why it is the health providers have lower turnouts? Is it their hours?
Yeah, so the study that we are citing there didn't go too in depth on, actually asking people why they didn't vote, but from the current population survey that they used to get that data, the responses were really similar to what we see in the general population, but I think heightened because of the schedules and the overcapacity that we have in the health sector. And the number one reason why people don't vote is because they weren't registered, or they didn't know how to navigate the rules and regulations in their community to get their ballot and cast it. And so that's why it's really important that even if you're thinking to yourself, oh, I vote every election, I know what I'm doing, I know where my polling location is, I know I'm registered, that you check before the deadline, that you make a plan, and that goes in detail of even what time you think you're going to go vote, if you're going to go vote early, how you're going to get there. And really, again, before October 7th, make sure you know if your voter registration is up to date, and take the steps needed to make sure it is, if not.
Yeah.
Awesome.
There's another reason that I'm thinking, and that is that as health professionals, lots of times people think, well, I'm already doing all this work and that's not my work. Like they may not see the relationship, and that's why we need all of you to be messengers to say, look, if we're going to work to improve the health of our patients and of the populations that we're serving, this is also our work. And someone just posted a message about the valid about if you're trying not to be publicly recognized where you're living. For example, because of a domestic violence situation, you may have more difficulty registering to vote because the systems don't recognize post office boxes as valid residences. And that's definitely, these are the kinds of barriers that we see making a real difference in who participates. But this person, is it Christine? Gave a resource there that we should be sure everybody sees. At the Secretary of State's office, you can get a resource on how to register even if you have a PO box.
Yeah, that's a helpful hint. Thank you, Christine. Well, knowing this, I'm definitely going to make sure that all the healthcare providers I work with are planning on voting and making sure they're registered. Travis County, where I live in. Oh, yeah, go ahead. Sorry.
One other thing Nora didn't mention was that if you fill in that form, that individual pledge form, the research shows us that you're more likely to vote. So even though you think you're going to vote.
Oh, we lost Jean. But I think he was referencing the social science literature that shows that even if you think you're going to vote, pledging to vote makes a difference. And it allows us to send you reminders about those deadlines and upcoming civic holidays to ensure that it's not something that you think you're committed to and then forget come election day. I can't tell you the number of times I've almost forgotten to vote and been reminded in my community while walking my dog. And so pledging to vote, I think really, really makes a difference.
Awesome.
And Lisa, there's a question about the CHES and NCHEC CEs in the chat.
Oh, yes.
We'll leave the CHES link for CEs. I'm assuming yes.
I'm going to repost that right now. Just complete the form in the chat box. So there's two different, if you're a if you're a social worker, there's one, and we also have one for CHES and MCHES. So, and we thank all of you guys for attending and participating and encouraging all of your friends and coworkers to vote as well. But we will send out a follow-up email with this link to pledge to vote. And then actually I'm going to share this information that Christine shared because that was new to me. So thank you so much. Do you guys have anything to add before we go? I don't see any more questions.
Someone also asked whether or not they could get the data from the slide deck. You can the slide deck will be available too, right?
Yeah, I will send it to Lisa, who can send it out in the notes after.
And also you can find a lot of that data on our website and at the Health and Democracy Index site.
Perfect. Let's see. Oh, okay. I didn't share to everyone. Sorry, I'm gonna post it again. Right before we go. Just in. Sorry, I'm trying to do too many things. Okay. Well, great. Thank you so much for being here. You guys brought a lot of insight, and I'm really glad that we were able to get you in here, especially to celebrate National Voter Registration Day. Yeah, please reach out to me if you aren't registered near around Austin. I will come to you. And if not, I can try to find you somebody or a place where you can vote locally. And I'll be sending out this information. Thank you so much.
Thank you.
Thank you. And thanks, Sophie, for hosting.
Thank you. All right, have a good day, everyone.
Bye.
Bye, everyone.